Hi there, this is Nursing Education Videos. Today I will be going over the deep vein thrombosis NCLEX questions on registerednursern.com. I will be reading the review notes and doing the quiz at the same time. I hope this information is helpful for your learning. All credit for this information that I am reading goes to Sarah at registerednursern.com. Again, all credit for the information that I am reading goes to Sarah at registerednursern.com. Please refer to the websites in the description box for all credit and information. Links for the information will be included in the description box. So a deep vein thrombosis, DVT, is a blood clot that forms within the vein. According to Virchow's triad, a blood clot can form within the vein for several reasons. As the nurse, you will want to be familiar with the prevention of a blood clot, so venous thromboembolism, acronym is VTE, and the management of a DVT and anticoagulation therapy. Don't forget to check out the other NCLEX review quizzes in the series and to watch the lecture on deep vein thrombosis before taking the quiz. This quiz will test your knowledge on deep vein thrombosis in preparation for the NCLEX exam. Which statement below is correct about a deep vein thrombosis DVT? A. Veins that are most susceptible to a deep vein thrombosis are the peroneal, posterior tibial, popliteal, and superficial femoral. B. DVTs tend to mostly occur in the lower extremities but can occur in the upper extremities too. C. A deep vein thrombosis in the lower extremity has a low probability of becoming a pulmonary embolism. Or D. A DVT is a type of venous thromboembolism, VTE, which is a blood clot that starts in the vein. So this one is probably C. So on the review notes on registerednursern.com, the statement is DVTs in the lower extremities tend to have a higher chance of breaking off and turning into a pulmonary embolism, so turning into a PE, which is pulmonary embolism. So that would be C. Question number 2. Select all the factors regarding a deep vein thrombosis that are included in Virchow's triad. Is it A. Hypocoagulability, B. atherosclerosis, C. endothelial damage, D. stasis of venous blood, E. excessive coagulability, or F. increased venous blood flow? So these are the 3 factors that would increase a risk of deep vein thrombosis. So hypocoagulability means it's not going to coagulate, so it's not going to stick together. The answer here is probably C, D, and E. So endothelial damage, stasis of venous blood, and excessive coagulability. So we'll check to see. Yeah, the mnemonic here is she, which are the risk factors, is S for stasis of venous circulation, H for hypercoagulability, so that would be excessive coagulability, which means increased risk of forming a blood clot. And then E for endothelial damage to the vein. So C, D, and E. Question number 3. Based on Virchow's triad, select which patients below are at risk for the development of a deep vein thrombosis. Select all that apply. A 55-year-old male with hyperlipidemia and diabetes. B, a 70-year-old female with severe sepsis. C, a 25-year-old male who uses intravenous drugs. Or D, a 65-year-old female who is post-op day 1 after joint replacement surgery. So this would be based on the 3 factors that could increase the risk of deep vein thrombosis. So what are some conditions that cause an increased risk of forming a clot within the vessel? There is a condition here is severe illness such as sepsis. So B, the 70-year-old female with severe sepsis. And then C, a 25-year-old male who uses intravenous drugs. That's a condition that causes damage to the endothelial lining. And then 65-year-old female who is post-op day 1 after joint replacement therapy. That could be a risk for immobilization. So that's a stasis of blood flow. And then hypercoagulability. It doesn't say anything here about hyperlipidemia or diabetes, but we can on the review notes it doesn't say anything about hyperlipidemia or diabetes for Virchow's triad. So this would be B, C, and D. Question number 4. You're developing a plan of care for a patient who is at risk for the development of a deep vein thrombosis. After surgery, what nursing intervention below would the nurse not include in the patient's plan of care to prevent DVT formation? A, the patient will eat all meals out of the bed daily by sitting in the bedside chair. B, the nurse will apply sequential compression devices, SCDs, per physician's order to the patient's lower extremities every night at bedtime. C, the nurse will administer per physician's order enoxaparin in the subcutaneous tissue of the abdomen. Or D, the patient will ambulate daily. So this is what nursing intervention below would the nurse not include in the patient's plan of care to prevent DVT formation. So we can look at the nursing interventions. So these are preventions. So it says here, make sure the patient is wearing the SCDs. While sitting or in bed, and then take them off when the patient is walking. And here it only says to apply them every night at bedtime. So it would be B. Question number 5. The nurse is assessing a patient who has many risk factors for the development of a DVT. For signs and symptoms of a deep vein thrombosis. What signs and symptoms below would possibly indicate a deep vein thrombosis is present? A. Cool extremity. B. Decreases pulses. C. Redness. D. Pain. E. Warm extremity. F. Swelling. G. Cyanosis. So it would be B. Decreased pulses. C. Redness. D. Pain. E. Warm extremity. F. For swelling. And cyanosis could be present. G. We'll double check the notes over here. So redness would be C. Swelling would be F. Very warm would be E. And then P for pain. It doesn't include decreased pulses or cyanosis. So it would be C, D, E, and F. Question number 6, true or false? Assessment of Hohmann's sign is the most reliable indicator of a deep vein thrombosis. This would be false, because it's not reliable for detecting a DVT because of false positives. Hohmann's sign is where the patient extends the leg and manually dorsiflex the patient's foot, bend it up towards the shin. If it causes the patient pain, it is considered a positive Hohmann sign. Question number 7. A patient is receiving continuous IV heparin for anticoagulation therapy for the treatment of a DVT. In order for this medication to have a therapeutic effect on the patient, the APTT should be, so A prothrombin time. Answer A, 0.5 to 2.5 times the normal value range. B, 2 to 3 times the normal value range. C, 1.5 to 2.5 times the normal value range. Or D, 1 to 3.5 times the normal value range. I think for APTT it was C, 1.5 to 2.5 times the normal value range. Yeah, so on the notes over here, monitor APTT activated partial thromboplastin time, 1.5 to 2.5 times normal range. So answer is C. Question number 8. A patient who is receiving continuous IV heparin for the treatment of a DVT has an APTT of 110 seconds. What is your next nursing action per protocol? A. Continue with the infusion because no change is needed based on this APTT. B. Increase the drip rate per protocol because the APTT is too low. C. Redraw the APTT stat. D. Hold the infusion for 1 hour and decrease the rate per protocol because the APTT is too high. For the nursing notes over here, it says greater than 80 seconds is 80 seconds risk for bleeding, dose decreased. So at 110 seconds, your next nursing action per protocol would most likely to hold the infusion for 1 hour and decrease the rate per protocol because the APTT is too high. Question number 9. You're educating a patient about warfarin, and the other name is Coumadin. How it is used to treat blood clots. Which statements by the patient require you to re-educate them about how this medication works? Select all that apply. A. This medication will help dissolve the blood clot. B. This medication will prevent another blood clot from forming. C. This medication will help prevent the blood clot from becoming bigger in size. D. This medication starts working immediately after the first dose. So this would be B. This medication will prevent another blood clot from forming because it's an anticoagulant. Question number 10. A patient is prescribed warfarin for the treatment of a blood clot. So it says bracket, Coumadin, for the treatment of blood clot. What is the therapeutic INR range for this medication, which is the international normalized ratio? A 2 to 3, B 1 to 3, C 4 to 8, or D 0.5 to 2.5? I think it was 2 to 3. A. Alright, yeah, it is 2 to 3. So, the question is, what is the therapeutic INR range for this medication? Answer is A, 2 to 3. Question number 11. Which option below is considered a positive Homan sign for the assessment of a deep vein thrombosis, DVT? A. The patient reports pain when the foot is manually dorsiflexed. B. The patient reports pain when the foot is manually plantar flexed. C. The patient experiences pain when the leg is extended. Or D. The patient experiences pain when the leg is flexed. So we will go up to one sign. It is manually dorsiflexed. So A. Question number 12. Your patient has a deep vein thrombosis in the left lower extremity. The patient is prescribed continuous IV heparin. Select all the nursing interventions that are appropriate for this patient. A. Apply cool compresses to affected extremity. B. Measure leg circumference. C. Massage affected extremity. D. Elevate affected extremity above the heart level. E. Encourage frequent ambulation. F. Monitor the patient's INR level. G. Monitor the patient's APTT level. Or H. Apply sequential compression device SCD to the affected extremity. So we would measure leg circumference, I think. Monitor the patient's APTT level, which is G, so B and G. H applies sequential compression device to the affected extremity. I'll double check the notes over here. So this one is, if patient has a DVT, it is pneumotic deep clot. So D for don't rub or massage affected extremity, it can dislodge the clot. E, elevate the affected extremity above heart level, so this would be answer number D, or answer D. Then E is to ensure bed rest, so do not ambulate, so it's ensure bed rest. And then P for pharmacological measures. Then L or C, which is compress with warm/moist, which helps with pain and circulation. O, observe for signs and symptoms for PE. And then T for tight compression stockings. Thigh or knee-high compressions per MD orders help promote blood flow and decrease swelling. Changed regularly and show patient how to apply. Fitted and applied properly as prescribed, compression stockings may prevent post-thrombotic syndrome, which happens sometimes after the development of a DVT. This is because vein valves and walls become damaged due to the clot. Blood flow in the right directions, which is back to the heart. So it would not be H. H applies sequential compression devices to the affected extremity is a prevention, not a treatment if a patient has a DVT. So this would be B, D, and G. Question number 13. A patient's D-dimer result is less than 500 nanograms per milliliter FEU. The nurse knows that the D-dimer assesses underlined, and this result means. So FEU on the notes here is fibrinogen equivalent units. So this result would mean A, fibrin degradation fragment, positive for a blood clot, or B, platelet degradation protein, negative for a blood clot, C, clotting factors, positive for a blood clot, D, fibrin degradation fragment, negative for a blood clot. So less than 500 nanograms per milliliter, that is a normal D-dimer. And being a normal D-dimer, that means it's a negative for a blood clot. It would be answer D, fibrin degradation fragment, negative for a blood clot. Okay, I'm going to double check these answers to see if they're right. Okay, the results are your grade is A and percentage of what you got right is 92. So we will see what we got right and got wrong. So question number 1 is correct. Then we'll just go see what we got wrong, or what I got wrong. It is question number 9. So if we look at question number 9, you're educating a patient about warfarin, so Coumadin, and how it is used to treat blood clots. Which statements by the patient require you to re-educate them about how this medication works? So I chose B. This medication will prevent another blood clot from forming. So the understanding of this question is, which statements by the patient require you to re-educate them about how this medication works? And selecting all that apply would be A. This medication will help dissolve the blood clot, and D. This medication starts working immediately after the first dose. So warfarin, so the answers here says the answers are A and D. Warfarin, so bracket Coumadin bracket, does not dissolve blood clots. It prevents blood clots from forming, and if one is present, it will help prevent it from becoming bigger. If the blood clot becomes bigger, it may break off and travel in blood circulation. This can lead to pulmonary embolism, heart attack, or stroke. Warfarin, so bracket Coumadin bracket, does not start working immediately. It takes about 3 to 5 days of scheduled doses to start achieving a therapeutic international normalized ratio (INR) level. It is very common that a patient will be on heparin while taking warfarin until INR levels are therapeutic. And so was the question that I got wrong. Thank you for listening. I hope this information was helpful and engaging. Please feel free to subscribe and click the like button, and go to registerednursrn.com for more information and check out their YouTube channel. And again, thank you, and I hope everyone has a great day.